Hi, my name is Isabella and I'm a nursing education student. Today I'm going to be performing a head, ears, eyes, nose, and throat assessment on you today. Can you go ahead and state your name?
Angela Palazzolo.
And is it okay if we do this exam today?
Yes.
Okay, great. Before we start, I want to go ahead and perform hand hygiene. During this exam, I will be touching you. Is that okay?
Yes.
All right. So just starting off with examining the head and the scalp. Her head is normocephalic. I don't see any deformities or abnormalities. I'm going to go ahead and palpate your head, checking for any lumps or bumps, and I don't feel any. Her hair is evenly distributed, and I'm going to go ahead and check the scalp for any nevi, lice, any abnormal features, and everything looks great. So I'm going to go ahead and move on to the face. So my patient's eyes are symmetrical, nose is midline, lips are intact, eyebrows and eyelashes are evenly distributed, and her skin tone is appropriate. I'm going to go ahead and palpate your frontal and maxillary sinuses. So let me know if you feel any pain or tenderness.
No.
Any pain or tenderness?
No.
Good. I'm going to go ahead and do a couple of facial exercises, checking for that facial cranial nerve. Go ahead and smile for me. Puff out your cheeks. Good. And close your eyes tight. Don't let me open them. Good. I'm going to go ahead and check the trigeminal nerve. I'm going to take a soft cotton pad, place it at different places of your face, and you just let me know if you can feel them.
Yes. 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 Yes.
Good. We're going to go ahead and move on to the eyes. So my patient's eyes are symmetrical, sclera is white, irises are both the same color. I don't see any redness, drainage, or irritation. I'm going to go ahead and lift your eyelids down to check your conjunctiva, which is pink and moist, and the upper eyelids are also pink and moist. I'm going to go ahead and palpate your lacrimal apparatus. And I'm going to go ahead and do a couple eye exercises for you for my exam. So I'm going to go ahead and take my pen light. We are going to check first for pupil constriction, and then the cranial nerves that I'll be checking consist of the 2 and 3, the transducent, and the trigeminal, the trochlear, and the abducens. So I'm going to go ahead and shine this light in your eye and look for direct and consensual constriction. So my patient's eye grade is at a 3. So I'm going to go ahead and shine the light in your eye, look straight at me, and the direct is constricted, and then the consensual is constricted as well. I'll check on both sides as well, and they are the same. We're going to do a couple of eye movements. I'm just going to have you look at this pen light and follow it with just your eyes. Good. I'm going to go ahead and test for accommodation. Follow it with your eyes and then all the way out. Good. I'm going to go ahead and then check the corneal reflex. So just go ahead and look straight at me. Checking that corneal reflex. Good. And then I'm going to go ahead and assess your peripheral vision. So you let me know when you can see my fingers.
See? See? Yes. 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 Yes.
Good. We're also going to do the cover and uncover test. I'm going to take a piece of paper, cover one of your eyes, and you're just going to focus straight on me, okay? I'm checking for any lateral movement of the eye, and none is present. I would have my medical assistant perform a Snellen test on my patient, and I would just obtain the results from her. I'm also going to perform a fundoscopic, fundoscopy, 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 fundoscopic exam. This checks the back of the eye region of my patient. I will be checking for the red light effect when I shine the light in my patient's eye. I'm using my right eye to check her right eye, and I notice both symmetrical red light effect, and I could also be able to see the optic disc, the macula, and the fovea centralis of my patient. And I would be checking both eyes. For any abnormalities, I can see her blood vessels as well. I'm going to go ahead and move on to the ears. So just by assessment, I'm checking her external ear features first, and both appear symmetrical. I don't notice any redness or swelling. All the external features are within normal limits. I'm going to go ahead and palpate. Do you feel any pain or tenderness?
No.
Okay, great. I'm going to go ahead and take my otoscope, and I'm going to do a visual exam of the inside of your ear. Do you have any history of ear infections?
No.
Okay. So I'm going to go ahead and lift up the ear and look inside, and I can see the bony landmarks, the corneal light, and the pearly gray tympanic membrane. There's no redness present or no impaction of cerumen on that side, and I'll do the same on this side, checking for those landmarks as well. I'm going to go ahead and do the whisper test. This is testing the vestibular cochlear nerve. I'm going to go ahead and have you cover one ear and repeat after me.
Apple.
Good. And on the other side?
Orange.
Good. I'm going to go ahead and move on to the nose. So based on the assessment, my patient's nose is midline. There's no deviation or abnormal features. I'm going to take my same otoscope, and I'm going to observe the inside of my patient's nose. So I'm just going to have you lift your chin up, and I'm going to go ahead and assess the inside. I'm not noticing any redness or drainage or swelling. I can see all landmarks of the nose. And I'm going to have my patient perform a patency test. I'm going to have you cover one nostril and breathe in, and then cover the other nostril and breathe in. Great. I'm going to move on to the mouth, and based on my patient's assessment, mouth is intact. There's no cracks or lesions. I'm going to use my pen light to observe the inside of my patient's mouth. So go ahead and open for me. The buccal mucosa is pink and moist. Hard and soft palate are intact. Go ahead and stick out your tongue and say ah.
Ah.
The glossopharyngeal and the vagus nerve is intact. Go ahead and lift your tongue up. Good. Teeth are intact. And go ahead and stick out your tongue and move it from side to side. The hypoglossal cranial nerve is intact as well. Good. Thank you. And then I'm going to go ahead and just palpate a couple different regions of your face. So we're going to check that the frontal or the temporal artery here. Any pain or tenderness?
No.
I'm going to be checking for TMJ. Go ahead and open your mouth and move side to side. There were no clicks. Any pain with that?
No.
Good. I'm going to go ahead and palpate some of your lymph nodes. So I'm just going to check the preauricular, postauricular, submandibular, your tonsillar, your submental. We have the superior cervical chain, the posterior cervical chain. I'm going to have you turn your head slightly to the right, checking that deep cervical and to the left on both sides. I'm going to go ahead and check the supraclavicular, and I don't notice any swelling or any fixed lymph nodes or nodules. I'm going to go ahead and assess the neck. Can I have you turn your neck to the right, face the wall, and the other wall to the right? Good. Chin to chest and chin to the sky. Good. I'm going to check that spinal accessory nerve. So go ahead and lift your shoulders up. Press your head with my hand, other side, your head with my hand, and the back of your head with my hand. Good. And then I am going to go ahead and assess your thyroid. So I'm going to go ahead and just by looking at the symmetry. There's good symmetry, there's good contour. I can go ahead and I'm gonna go behind my patient to perform a posterior exam. Let me know if you feel uncomfortable. I'm gonna place my hands right here. Go ahead and swallow for me. I'm able to feel that isthmus rise, and I'm able to palpate that thyroid, the cricoid cartilage, and the isthmus here. Go ahead and turn your head to the side, and I'm palpating those lobes to the other side, checking for any lumps or fixed nodules or any abnormalities. If I did feel that there was any abnormalities, I would go ahead and take my stethoscope and I would auscultate over the thyroid and listen for a bruit. And if I am able to hear a bruit, I would know that that is an abnormal feature. I am going to try to see if I missed anything. I don't think so. So that does conclude our exam. Did you have any questions for me?
Nope.
Okay, well, thank you so much.
Thank you.